Good morning or afternoon, depending where you're connecting from. Flavia Carbonari, and I'm a senior consultant with the World Bank on Social Development, Gender Violence Prevention, and a non-resident fellow on global cities at the Chicago Council on Global Affairs. On behalf of the City Hub and Network for Gender Equity, or CHANGE, I'm pleased to welcome you today to our discussion. Over the next hour, I'll be joined by city leaders and gender experts from across 4 continents to explore the question, what can cities do to advance gender equity? This question is at the heart of CHANGE and its mission, and today marks the Cities Network's first anniversary. 1 year ago, the local leaders of CHANGE's 6 co-founding cities came together to launch this initiative. We're back here today to share some of the gender equity efforts the cities have been working on and some of what they have learned from working together about how more cities can get engaged. Before we begin, please know that the program will be available in both English and Spanish. To change your language, simply toggle the button on the bottom left side of the video player. Para cambiar de idioma, seleccionen el botón de interpretación abajo en la pantalla. I would also like to take this opportunity to thank some of the many people who made CHANGE and this event possible. The member cities of CHANGE and its project coordinator, Holly Milburn-Smith, the Mayor's Fund for Los Angeles, Splendid Media, the Robert Wood Johnson Foundation, and Open Society Foundation. These organizations have contributed transformational support that has brought change to life and will enable the network to continue this critical work to achieve gender equality in this generation. To kick off our program, we'll hear from a few of our CHANGE mayors as they welcome you to the discussion.
1 year ago today, our 6 cities joined together to launch the first international city-led network focused exclusively on gender equity.
We call it CHANGE. Our goal is ambitious, to achieve gender equality in this generation.
The COVID-19 pandemic has led to setbacks around the world. Women, girls, and persons of marginalized genders have been disproportionately impacted by job loss, increased caregiving responsibilities, domestic violence, and more.
But the good news is that cities have the tools and the will to build a more inclusive and equitable world.
Y cada una de las ciudades del cambio, de las ciudades CHANGE, ha puesto en marcha nuevas iniciativas para avanzar hacia una mayor igualdad.
Our cities are made up of more than 50 million people across 5 continents.
We come from different cultures and we speak different languages.
Pero hay mucho que podemos aprender las unas de las otras.
There is so much that we can do together to advance gender equity.
And today, just 1 year after launching our network, CHANGE is releasing a Gender Equity Toolkit.
We're sharing strategies that worked in our cities, and we hope you will share what is working in yours.
Juntas podemos lograr la igualdad de género en nuestras ciudades y en el mundo.
So to learn more about our global partnership, please visit us at citieschange.org. And thank you.
Hello and welcome again. My name is Nina Hachigian. I'm the Deputy Mayor for International Affairs for the City of Los Angeles. As you just saw, CHANGE is a network of cities bound by a shared commitment to achieve gender equality and the belief that our cities have an important role to play in making that change. On behalf of the City Hub and Network for Gender Equity and our co-founding chair, LA Mayor Eric Garcetti, I am delighted to share with you something that CHANGE has been working on for the past year. But first, I want to take the opportunity on CHANGE's 1 year anniversary to welcome the newest member city to our network, Buenos Aires, Argentina. Buenos Aires is a leader in capturing and reporting data on gender equity. And as you'll hear later in the program, they are taking innovative steps to expand access to caregiving throughout the city. So welcome. We are excited to learn from these examples among many and from your leadership in this field. I have been somewhat of a serial entrepreneur when it comes to establishing organizations focused on gender equality. As U.S. Ambassador, I co-founded a group called Women Ambassadors Serving America, an effort that started as a text chain and evolved into an advocacy group for women serving in U.S. diplomacy. I'm a founding member also of the Leadership Council for Women in National Security, or LC-WINS, a group of women in foreign policy working to achieve greater representation in senior leadership and throughout the national security workforce. When I became Los Angeles' first deputy mayor of international affairs, it was clear that Mayor Garcetti had a vision for centering gender equity in the fabric of our city. But as we began to work closely with cities like Barcelona and Freetown, it became clear that there are many ways to apply a gender lens throughout the work of local governments and a desire to learn from each other. And change was born. So I am delighted to share with you today on this first anniversary of change, a Gender Equality Toolkit, a deep dive into how cities can make gender equity a central, motivating feature and a value in all that they do. I want to express my deep thanks to Ann Norris, an expert in gender policy and the principal author of this toolkit, who spent time with each of the change cities to learn more about how they work toward this goal. And I would like to thank Jenny Lynn and Jessie Castillo, the brilliant designers who helped bring the final version to life. And of course, my team, Erin Bromagen, Helly Milburn-Smith, and Angela Kim. This toolkit highlights 4 ways in which cities, as employers, as innovators, as service providers, and as connectors, can get started and use their unique position to advance equity in their communities. I hope you take time to visit changecities.org to download the toolkit. It's very beautiful, and it's available in both English and Spanish. And let us know what you think. Thank you, and I'd now like to introduce Melissa Burton, who will lead our first conversation. Over to you, Melissa.
Thanks, Nina. I'm delighted to be here for the launch of the Gender Equity Toolkit. My name is Melissa Berton. I'm the Executive Director for the PAD Project. The PAD Project is a global organization dedicated to eradicating period stigma. We're based right here in Los Angeles. We are behind the Oscar-winning documentary, Period End of Sentence, and we have partners in 15 countries around the world. So I'm thrilled to be here with Change, and we are in partnership with you to remove the systemic barriers faced by women and people who menstruate of all genders. And so now I'd like to introduce for this fireside chat, and I don't know if you can see her yet, but she actually has a fireplace behind her, Ruth David. Ruth David is Deputy London Bureau Chief and Senior UK Correspondent for Bloomberg. She joined the company in 2010 in Mumbai and was part of its award-winning coverage on the country's top banks and microfinance crisis. Ruth has been a reporter on European mergers and acquisitions team in London since 2012, breaking news on some of the biggest deals in share sales in the continent. So I'm delighted to be moderating this conversation with her, and I'd like to reintroduce Flavia, Senior Consultant at World Bank and non-resident fellow of the Chicago Council on Global Affairs. Let's begin this fireside chat. So Ruth, first question to you. You recently published an analysis stating that the world's top global business cities are failing working women. Can you tell us what you mean by that and what you found in your research?
Yes, thank you, Melissa, and thank you to all of you for having me. To just take a little step back, in March this year, at the height of the pandemic lockdowns in London, a 33-year-old woman named Sarah Everard was kidnapped from a London street while she was walking home. It later emerged that the man who kidnapped, raped, and murdered her was a serving police officer. And the communal outrage and grief that sparked among women in the city prompted us to take a look at some of the world's top business cities and how they were doing when it came to gender equality and women in the workplace. So we decided to look at 15 cities. This was a project that we had never seen done before, and we wanted to start small. But all of these cities were hubs of business in their respective regions. Los Angeles was one of them, London, Tokyo, New York, and they were attracting women and men from other countries or cities, and they were viewed as generally desirable to work in. We measured them with publicly available data on 5 pillars, maybe that can come up on the screen. We looked at wealth, maternity, mobility, safety, and equality. which are the things that women think about when they're working in a city, and they're very different from what men would be looking at. In addition, we surveyed at least 200 women in each city and had one of them speak to us on the record to talk about the highs and lows of living and working there, just so we could capture any nuances that the data might be missing. The short answer was no place is doing very well. None of the 15 cities scored above 4 out of 5 in our rankings. Toronto came out on top and Sao Paulo in the bottom. But in each of these cities, we found inequalities were rife. And those that did well when it came to gender equality in the workplace because of legislation around it, for instance, talk about Berlin, Paris, London, they scored poorly on safety. But sometimes even the data was not capturing the whole story. So if you look at cities in Asia or in the Middle East, Hong Kong, Dubai, Singapore, the informal labor force is not really captured in the data. And the thing is, women are mainly employed in these lower paying jobs as house helps. These are often immigrants and they don't have much protections. That's one thing. The other thing we found was that cultural barriers play a role too. So in the cities of Hong Kong, Seoul, Tokyo, there's barriers to women working after marriage and kids, which is why in Japan, for instance, we have the lowest percentage of women in management, 13% among all the countries and city-states we looked at. But like Tokyo's first female governor, Yuriko Koike, told us, the way to ensure lasting change is to have more women in decision-making roles in both companies and in businesses.
Thank you, Ruth. That's really compelling data that you're presenting, and I appreciate so much hearing that from you. Flavia, you have also published recently research that examined how cities serve their female residents who are among the greatest risk of gender-based violence. Can you share some of what you have learned in your research?
Sure, and thank you, Melissa, for the opportunity to share the findings of this research, which was commissioned by Peace in Our Cities Network in 2020, actually as part of their efforts to understand how local governments were coping with different challenges brought by COVID-19. And in this piece, we looked specifically at actions that could be taken by city governments to protect women whose violence burden had increased during the pandemic. As we know, because of quarantine and lockdown measures, many women were left confined with abusers at home in a context of more social and economic stress, more caretaking responsibilities, and lower access to formal services and other informal networks of support. So women were also more exposed to violence in public space since there were less people circulating in the streets. There are also increased risks for both labor and sex trafficking because of the economic impact of the pandemic and changes in migration due to travel restrictions and border controls. And finally, the amount of time spent online also meant more risks of online violence. So data started to emerge confirming increasing trends of different forms of violence against women, leading to what many were calling a shadow pandemic. Increases in calls to helplines, police reports, demand for shelters, and even femicide started to be documented all over the world, including São Paulo, which is the city where I'm from, and Ruth mentioned in her research. I'm sad that we were in the bottom, but hopefully this is changing. And regardless of country or city context, population size or culture, we saw this alarming trends. The good news, on the other hand, is that this context also became an opportunity for policy innovation at the local level to respond to this challenge. So first, we saw that a lot of governments started to strengthen or expand response and protection systems to victims of violence. For example, helplines, support centers, shelters were reinforced by hiring additional personnel, providing specialized and additional training, including in the provision of remote virtual services. A lot of innovation also emerged in the introduction of new ways of reporting and accessing support, for example, through WhatsApp, online chat, video calls, or code word systems implemented in essential business such as grocery stores, pharmacies. So for example, women could go and request a specific type of mask that would be a code for I'm seeking help. Another important trend that we identified was in the justice and law enforcement responses to facilitate reporting and access to legal services. So this included expediting access to or renewal of restraining orders, establishing virtual court hearings, providing online legal services, and expanding training, for example, to police officers to assist domestic violence cases. There was also a lot of investment in awareness raising initiatives. This included broad campaigns on the increased risks of violence that women were facing, so people could be more attentive to it, and massive dissemination of information about service that they could access. These campaigns used in general multiple types of platforms and tried to leverage national, local, community-based and private sector actors to reach a broader audience, as well as more targeted locations and groups. So everything from television, radio, paper flyers posted in neighborhoods, pharmacies, grocery stores, and other public spaces like elevators, public transport stations. There were also some efforts identified to prevent violence against women in the public space. So for example, some cities established partnerships with the private sector for free or discounted transportation services, such as taxi apps or Uber for women. These were just some of the responses we found being implemented in cities all over the world during the pandemic to address this issue. It's important to highlight that in most cases analyzed, there was a combination of these different types of measures. And this is very much necessary since the complexity of this problem requires action by multiple sectors and actors and comprehensive and integrated responses. So for example, if you raise awareness, but you're not ready to respond to an increase in the demand that you may receive, you might be hurting more women. And although several of the policies were implemented in a context of crisis, many of them were understood as action that can be and should be in place in the longer term. Because as Ruth's research also showed, this other pandemic already existed pre-COVID, with 700 million women experiencing physical or sexual violence in their lifetime, at least once. So the risks that women have to live with are still present every day in our cities, and governments should prioritize addressing them accordingly. Thanks, Melissa.
Thanks, Flavia. I really appreciate the thought and sensitivity of all of those initiatives that you talked about. I love in particular that detail of a certain color mask as a cue that somebody might be suffering from gender-based violence. I'm going to ask a question now for both of you, and then I'll have Ruth answer first and then Flavia. So you both touched on the fact that the issues that women and those of all marginalized genders face are driven by both structural and deeply embedded social realities. The City Hub and Network for Gender Equity exists because its members believe in the potential that local governments have to make systemic changes that address these issues. Where do you think the greatest opportunity lies for governments seeking to make that systemic change? Where have you observed the most success? Ruth?
I think we can put it into three baskets, maybe: mobility, maternity, and gender pay. And I appreciate that in some of these, the federal governments have more say than the local governments. But mobility, for instance, something as simple in London as the night tube coming back, more people are out on the streets. It's easier for women to commute safely. The push in cities like Paris and London over the course of the pandemic to have more bike lanes and to ensure that the roads are safe, they are well lit. All of these things make a difference when women go to and from work, right? I mean, maternity places in Europe do really well when it comes to legislating for maternity pay. The US, as we know, is one of 7 nations in the world that does not have maternity pay. And, hopefully that's changing. But even in places where there is maternity pay, if you don't have governments that try and ensure that there is good childcare, so whether that's access to enough kindergartens, whether that's kindergartens closing at a time where, men and women are both coming back from work. In Berlin, many women quit after they have kids because the kindergartens close at 1 p.m. And just doing all of these initiatives in partnership with the private sector. Because if a government says you need to have 9 months of leave for somebody who's on your payroll, who's a woman, but we're not going to subsidize it. We've seen in some countries, companies then say, okay, if that's the case, we're not going to hire a woman. So you ensure that you have discrimination in other ways. And when it comes to the gender pay gap, one of the things that we found, so the weighted average of the gender pay gap across the world is about 20%, and it stayed that way, sadly, for decades now. But in places where the governments have done things in terms of getting companies to disclose their gender pay gaps, getting companies to do audits, making local contracts that companies have, making them, reliant on whether you have equality on gender pay or whether you do these audits. In those places, you're seeing that the gender pay gap at the bottom levels of the labor ladder is pretty equal. You only see the problems when you come to the top, right? And those governments cannot control as much. So all of these measures make a difference. And when the governments are partnering with the private sector and doing a bit of carrot and stick, it makes it easier. When we spoke to experts, the one thing we heard was that the public sector needs to see childcare as a social infrastructure investment and not put all of the burden on women. And that also includes making it culturally okay. And, we've seen some great examples from LA even, where you say it's fine to be a father and it's fine to take leave when your child is born, just as much as the mother does. So I'd like to kind of conclude on that note of hope.
Here to that note of hope, and childcare definitely needs to be seen as an investment worth making. Flavia, what do you see as the greatest thing governments can do to help tackle systemic change or make systemic change for gender equity?
Thanks, Melissa. And I'm glad Ruth came first, because I think we complement each other quite a bit. A lot of the things that she mentioned are completely fundamental on any systemic change. And of course, when you asked that question, systemic change implied also addressing the root causes of the issues that we discussed earlier, right? So in the case of violence against women, which is the ultimate expression of the different forms of gender inequality that we see everywhere, this means investing a lot on prevention in the medium and longer term too. And cities can do a lot about that. So prevention includes implementing laws and policies that will reduce the gender gaps, some of which Ruth already mentioned, and this difference, the imbalance of power between men and women, which are actually at the core of the high levels of violence against women that we see every day. It also means strengthening protection systems that provide support to victims of violence, including helplines, one-stop shop centers, justice, police, and health service, alternative accommodation, and expanding awareness and access to information. We also need to tackle systemic economic and social inequalities, ensuring access to education and decent work, and changing discriminatory gender norms. So there are a couple of programs, types of policies that have been evaluated already and have proven to be very effective on that. Intensive community-based interventions that work with both men and women to change social norms have proven to reduce rates of intimate partner violence, for example. Educational programs can have a significant impact on norms by changing how women perceive their role in society, and also by engaging boys from a young age and changing their views on masculinity. Positive parenting programs with vulnerable families, something that cities can do through their social assistant work, for example, can also help to promote healthier relationships and have proven effective in breaking the intergeneration cycle of violence. Cities can also invest in preventing violence women in the public space. For example, and these were some of the cases that we saw in the research, by issuing laws with specific provisions against sexual harassment in public spaces, raising awareness and providing information about service and carrying out campaigns in public transportation areas, for example, and improving public infrastructure to make sure it's gender sensitive and safer for women. And to do all that, another crucial area for cities to continue to work on is the improvement of data collection and analysis. And Ruth's research is a great testament to that and a great contribution too. We need to have a clear understanding of the problem and be able to monitor progress of the policies that are implemented to address these issues, right? So we definitely need more and better data. So prevention of violence against women, which was what I discussed in the beginning, also relates to all the other areas that Ruth was also talking about, such as mobility, income, maternity provisions, because these are all linked to each other. And strengthening policies in those areas, for example, that may facilitate economic empowerment can also help women decide to leave an abusive relationship, for example. And one last point, it's crucial, again, echoing, and I'm sorry, Ruth, I keep bringing you up because you came in first and said so many important things, but it's crucial to have women involved in the decision-making and implementation process of all these actions. So cities should also take advantage of all the knowledge and experience from civil society and women's groups on the design and delivery of some of these actions. And partnerships at the end with civil society, community-based organization, as well as other actors such as the private sector and academia, is very important to ensure that these changes will indeed be systemic and that their results will be sustainable over time. Thank you.
Thank you, Flavia, and yes to you and women like you and Ruth in places of decision-making. Yes to ending gender-based violence. And thank you also for mentioning the importance of education. So in 2022, one of the things the PAD project is looking forward to is the recent passage of California Assembly Bill 367 makes period products free in public schools. So this is an initiative we're working on to make sure that no student has to miss school because of her period. And with that in mind, I want to turn it to Ruth and ask you, is there any research or particular initiative that you're looking ahead to in 2022 that you could share with us?
Maybe not so much specifically, but we're doing two things at Bloomberg. One is we are getting more female voices across the newsroom in our stories when we have people come on screen to enable us to tell the stories through their voices, which makes such a big difference. We are also looking at systemic inequalities. So we recently did a big piece on how the childcare system in the US, for instance, is broken, and it's so expensive to send your child to nursery, which is why so many young mothers need to quit because they cannot afford to pay that amount, right? We're also doing something in terms of the Paycheck podcast, where we look at the systemic inequalities in gender pay when it comes to the workplace and how that affects women. So those are kind of some of the things. Last year, we had a big story on menstruation and how it affects women in the workplace, but it's such a taboo topic. And the thing is, unless you get more women to talk about it, and unless you get more men also to talk about it, the cultural taboos around taking parental leave, for instance, we are trying to, through the voices and through the research, get as many stories out there to maybe change the way people think about these things. On safety, for instance, somebody told us, I never even thought about safety in a place like London or Berlin. But you know, you can imagine that person who said it was a man, because a woman would never say that. So one day at a time.
One day at a time. And thank you both for your tremendous insights. You've given us so much to think about this morning and so much hope for what we can do to implement systemic change. And so, Flavia, I'm going to turn it back to you to bring us into our next discussion, a chance for the cities of change to share a bit more about some of their really important work. And thank you for this wonderful conversation.
Thank you, Melissa. So now I'm happy to introduce the distinguished panel we have here today with us. Dr. Sonia Ruiz, Director of Gender and Time Policies from the Barcelona City Council. Heidi Davies, HR Advisor on Policy from Greater London Authority. Ingrid Gomez Sarasiva from the Secretary of Women, Mexico City. Florencia Estivelmacher, General Director of Public Policy for Gender Equality from Buenos Aires. And Ajara Bomba from the city of Freetown. Welcome, all of you. And Sonia, let's begin with you and listen a little bit from the Barcelona experience.
Thank you, Flavia. Good morning, good afternoon. It's a pleasure to be part of this network of cities, and happy anniversary to Change. Since 2016 in Barcelona City Council, we have been working in order to add a gender perspective in the fiscal system. While gender budgeting has more references in the academic literature and also in public policies, gender-based taxation system has less experience, especially at the local sphere. Therefore, we thank Change for including our project in this wonderful toolkit, and we would like to encourage many other local governments to join this challenge and to also share lessons learned. The distribution of economic resources between men and women is one of the fundamental criteria that shows to what extent a society is actually equitable, as our speakers just explained. And taxation, in addition to being an instrument to collect taxes, is actually fundamental in terms of transforming our cities with a feminine perspective. By fiscal policy, we mean the capacity to influence both on taxes and rates, as well as the prices for public services. In the Spanish context, local governments have limited possibilities in terms of regulating taxes and rates. So introducing a gender perspective in tax breaks, bonuses, and subsidies in order to balance inequalities becomes a tool to be explored. Based on feminist economists, we know that the tax system is not gender neutral and produces biases that must be shown and tackled. It makes domestic and care work invisible, discriminates against certain family models, such as single-parent families, or imposes itself on products generating, for example, menstrual poverty. And no one talks about this, such as Melissa and Flavia have explained. Thus, in the Barcelona City Council, through our own methodology, we carry out a gender impact assessment every time fiscal policies are approved. For example, municipal taxes and fees. Among others, taxes imposed on restaurant patios, vehicle taxes, and the most important in our case is property and real estate tax. This report tells us whether these laws increase or reduce gender inequalities. And we are also including aid for people in low income, widows, or single parent families. Right now, we're also studying other breaks that have to do, tax breaks that have to, or other issues that have to do with gender violence. Likewise, we do the same with public services and their prices. This is the price paid by citizens in order to access sport facilities, community center courses, museums, or home care services for dependents. Here we would like to continue offering discounts and universalizing some good practices that we know promote co-responsibility of care, equity in the use of time, the participation of women, the increase of their sports practice, or the fight against sexist violence. Fiscal policy for us, therefore, is a tool in order to have a feminist change. In the words of Beatrice Webb, one of the first women economists, true power is in giving instead of taking.
Thank you so much, Sonia. This is fascinating. I have read and heard a lot about gender budgeting, but I had never heard so many innovative things being done in the fiscal side. So this is really, I hope this can be shared with many more cities and we can see this adaptation in other contexts as well. I'm now pleased to share a message from the Tokyo Metropolitan government. Given the time difference, Tokyo was unable to join us in person for this event, but Akabain Tomoko, Senior Director for Gender Equality at the Bureau of Citizens and Cultural Affairs of the Tokyo Metropolitan Government, shared the following message and case study, which I'll read to you. I'm delighted that today we're celebrating the first anniversary of Change. Due to the time difference, unfortunately, I cannot attend the event in person, so I'll send this message. I regret not being able to speak with you directly, but I hope that we take this opportunity to further and deepen the friendship between our cities. It's a great pleasure to launch the Toolkit for Gender Equality today. This has been a significant project for change to tackle in its first year. Tokyo is implementing projects under the Comprehensive Plan for Promotion of Gender Equality, which was formulated as an action plan to comprehensively and systematically promote the initiatives of Tokyo government, residents, and businesses. As the current plan will end at the end of fiscal year 2021, we have set up a council with academic experts and others to deliberate on an updated plan. In the deliberations, the council is discussing various matters, including how to best develop a system of society that allows everybody to work with a sense of security, how to change the deep-rooted sense of fixed division of roles by gender, how to eliminate violence of any kind between men and women, and how to tackle the challenge facing women brought to the surface by the COVID-19 pandemic. I hope we'll contribute to the realization of gender equality around the world by sharing best practices. In closing, I wish to express my deep gratitude to everyone who made this event possible. Thank you, Akabain and Tokyo. We're sorry you couldn't be here, but really appreciate the effort of you sharing this experience and sending us this message. So now I'm pleased to turn to Heidi Davies from the Greater London Authority. Heidi, over to you.
Thank you very much. So I'm going to talk about our new menopause policy. The menopause affects a large number of women, but as others have referred to, it has been a taboo issue, and it's only relatively recently that it's become a topic for discussion, both in the media and in workplaces. In April 2021, the Mayor of London announced plans to support colleagues at the Greater London Authority, the GLA, which is the governance body for London, who are going through menopause transition, by introducing a new workplace policy, training for line managers, and other actions such as signposting to external support and awareness raising. So this work is well underway, and we plan to launch the policy and associated action in January 2022. So why are we introducing a menopause policy? Menopause surveys show that 59% of women experience menopause symptoms that affected them at work. 60% of menopausal women were negatively affected by symptoms at work. 72% of menopausal women felt unsupported at work. 61% of staff go on to experience symptoms of their menopause. Our policy document is a useful starting point, but we know that we need to take other action as well. Our aim is to create a culture in which staff can talk about menopause issues at work and to ask for help if they need it, without feeling that this is inappropriate or something to be embarrassed about. In developing our policy, we are working with our staff networks, the Women's Network and the Wellbeing Network in particular, and with our recognised trade union. We'll also be consulting more formally with various groups and also with staff directly. Against discriminatory behaviour, to provide information and also to provide some practical support. We outline what the menopause is and give examples of common symptoms and also workplace adjustments that could be considered for each of those symptoms. We give links to internal and external sources of help and information, and there is a lot of help now out there. And we have a guide for managers to help them understand how the menopause may affect their staff, what they can do to help, and to hold conversations about the menopause, how to hold conversations about the menopause. Other action that we're planning include e-learning aimed primarily at managers, but also any staff wanting to know more about any other news or events. We are planning lunchtime drop-in sessions so that staff can get together to share their experiences and support each other informally. We are also planning an annual menopause event timed on or around 18th of November, which some of you may know is World Menopause Day. We hope to recruit menopause advocates or champions, who would be volunteers, staff volunteers, and they would help to provide support and information to managers and others. And we hope also to provide some practical help. So that might be, for example, the provision of desktop USB fans. We're also proposing to gain menopause-friendly accreditation, which is a standard of achievement recognising inclusive employers, and that hopefully will help to build awareness and understanding around menopause. So that, in a nutshell, is what we're planning. And thank you very much for listening.
Thank you so much, Heidi. You were breaking up a little bit during your speech, but we could definitely hear most of it and understand. And this is also very interesting and innovative. And I'm really looking forward to reading more about all the activities you were doing around, as you said, a topic that has been such a taboo for so long. So really putting it out there and creating these policies is really something that should be praised for. So thank you for sharing. Ingrid, I'll then turn to you to tell us a little bit about the Sendero Seguro initiative in Mexico. Welcome.
Thank you. Thank you to all my colleagues that have shared this space or are sharing this space with me today. Congratulations on this anniversary to change the exclusion and invisibilization that women and girls have suffered in terms of urban development because of stereotypes and gender roles have had very specific effects in terms of the way women use cities and women's perceptions on safety. If you could assist me passing slides, it would be great. We are fully aware that any type of intervention that we may do has a different impact on women and men. Mexico City's government has started saying that we need to understand public spaces with a gender perspective, and that has helped us understand the different conditions that we all face in our daily lives, but especially women and girls in Mexico City, where we have a lot of diversity and plurality. We've identified 3 different dimensions. First, safety, accessibility. The city has to be accessible for everyone. Women need to be able to commute. And of course, then care. Women are the ones that mainly do domestic work and care work. And that's why in 2019, we launched a program known as Sendero Seguro, Walk Free, Walk Safe, in order to improve urban development and safety. We used technology for this purpose. Sendero Seguro is a program, is a priority for Mexico City's local government, and it's been implemented from the city council led by Claudia Sheinbaum, and it includes a comprehensive approach in order to recover public spaces and improve them with a positive impact, especially on the lives of women and girls that live and commute in our city. This program has 3 components. They have to do with improving the conditions of public spaces, replacing and increasing lighting, not only where there are cars, but also in those pedestrianized areas. We also want to increase green areas. We want to improve streets in order to increase accessibility, mobility, safe crossings, and we're also working on the inclusion of murals in different neighborhoods, in very urban areas, as well as in other more rural areas. We want to design murals that will show positive images that speak about the need to increase gender equality in the city. Another component, it has to do with technology to improve safety. We want to increase the number of security cameras as well as panic buttons. Women need to be seen, but we also need to be listened to when we ask for help. And the third component has to do with social and community actions. We are organizing marches about safety, but also marches to recover certain spaces with women, with different neighborhood groups, community groups, and so on and so forth. So far, we've seen very positive figures. We have improved 222.5 kilometers along 205 safe paths. There are almost 64,000 cameras and almost 11,000 panic buttons, and a digital panic button that is activated through an app that is called CDMX. In a nutshell, I would like to say that we've managed to decrease the number of crimes against women, all of them where women were victims. And here we can include sexual harassment by 28% along these safe paths. In 3 years, based on the polls that have been conducted, we've seen an increase of 36% in terms of the perception of better security among women. This is a good initiative. We are seeing very clear results so far. It is part of a very comprehensive strategy that has to do with addressing violence and preventing it. But today, I wanted to focus on our experience on public spaces. Thank you very much for your attention.
Thank you, Ingrid, and congratulations. I'm glad to see you already saw these very impressive results. This sounds like a very interesting and promising initiative to continue to. I'm now going to turn to Florencia from Buenos Aires.
Hello, greetings to you all. First of all, I would like to thank everyone's participation here today. It's truly interesting to listen to all this project throughout many cities in the world. In Buenos Aires, we have been mainly working on 3 different things of our agenda: employment and work, care, and violence. One way or another, all these issues have been addressed here today. What I wanted to share with all of you today is an initiative that we have been implementing in Buenos Aires regarding care. As you know, and as it has been said in the introduction, the economy of care, or care services of older people, of children, and so on and so forth, became very relevant during the pandemic, and it's been included within the public agenda. It became very clear that there is inequality in terms of the distribution of housework, and that it falls mainly on women. In March, we published a care map, the first map in Latin America that brings visibility to this type of work. What we did was to geo-reference all the different care spaces, private and public spaces, that we have in the city. I will now share this map with all of you so you can have a look at it. This map is available on the portal of the City of Buenos Aires. We can see the offer of these 3 different things, for example, childcare, older people, and also services for people with disabilities. And as you click on each one of these services, you can find all the basic information. For example, a phone number, what type of service is provided, where it is located. And then you can access another tool that the city offers, which is how to get there based on your location. This tool is available for neighbors. And while it's only an informative tool, it doesn't really improve the offer. We believe in Buenos Aires that this is a good first step in order to address the issue, address the challenges, as well as analyze on our side what type of vacancies there are, what type of opportunities, what type of gaps, what type of challenges we have in the city. Through this care map, we could bring visibility to the distribution of this type of service throughout the city, if there's enough supply, how many people benefit from these care spaces offered by the city of Buenos Aires, how we can actually incentivize, maybe through fiscal policies, the opening of new care spaces or services. This is a tool that has actually allowed us to identify many questions and analysis in order to develop public policies. On top of the map, on the same website, we also show all the different programs that the city has that has to do with care services. For example, subsidies for independent living. There is a registry of people that provide this type of service. So if someone needs to hire a professional, they can have access to that registry that includes people that are certified within the city of Buenos Aires, as well as other programs that are available for people with disabilities. This way, we are trying from the secretary to organize, bring visibility and quantify how we're doing in terms of providing care services in Buenos Aires, so that we can also promote more concrete public policies. This tool, like I said, is truly interesting because of the double use that we are providing. Neighbors have available all this information, have access to all this information. We've had around 30,000 monthly visits. And then for us, this is a great analysis tool in order to develop public policies. Like I said, all this is available on our website, buenosaires.org.ar/igualdad de género, and everyone is invited to navigate it and have a look at it. Thank you very much.
Thank you so much, Florencia. I'm actually a resident of Buenos Aires for many years now, and I'll make sure to look at all these resources. It's certainly a great tool that I'm sure is going to be helping several women. And now we're going to turn to our last speaker, Ajara from Freetown. Welcome, Ajara.
Hi, how are you? Good afternoon, everyone. Good morning. Thank you for having us here to represent Africa and representing Freetown. So I wanted to just speak a little bit more regarding our early learning centers. So statistics showed that in Sierra Leone that 13% of children have access, only 13% of children have access to early education. And then 9.5% of women who are in the country have only reached a level of higher secondary school education or high school education. So one of the things that the mayor of Freetown recognized when she was campaigning to become the mayor was that a lot of the children of the market women in Freetown, as she was going to different markets in different areas, they were always with them in the markets. So children between the ages of 0 to 5 would be seen playing around the marketplaces. And she just started thinking, you know, where are these children developing when it comes to early education? So one of her campaign promises was that she's going to create daycare centers, we call them early learning centers, at markets throughout the city. So after becoming the mayor in 2018, she sought out to get funding to support early education for children under 5. Again, in 2018, the government of Sierra Leone decided, you know, they want to give free and quality education for children throughout the country. However, they forgot the fact that, you know, early education was also a key component of that. So as much as they're providing the early education for a lot of the other students, they forgot those children at 0 to 5. So the mayor created in 2017, no, 2000. 2020, right before COVID hit, we launched the first early learning center at one of the markets here in Freetown. So the markets, the early learning center is for children of market women between the ages of 0 to 5. So these children of these women who work within the markets, the daycares are right on site at the markets, and they have the opportunity to get early learning education daily. So as their mothers go to work, they go to school and they get early education. We realize the importance of early education for, young people is, it's not just the cognitive and developmental learning, but we also look at the holistic aspect when it comes to promoting inclusiveness. So when you think about security, one of the things noticed recently is the rise of child trafficking and human trafficking. But with these schools getting so close and the community's involvement, we notice that the children are being watched. Of course, a lot of our students also wear uniforms. So the community knows and they kind of police what's happening when it comes to the children. This also gives the children the opportunity to practice responsibility. So looking out for each other, working together as peers. One of the other things we looked at was the holistic approach of that. So most of the women in the market are most of the vulnerable communities in the country. So these being a collective of women working together, we have seen where they can work together and support each other when it comes to learning positive parenting strategies from each other, when it comes to having a safe space to just communicate and collaborate with other women, and also shared resources when it comes to that. So whether it's, preparing lunch for the children, different people coming together and working together to take days and take turns when it comes to preparing lunch for their children. We've noticed that collaborative effort and that holistic approach. We also realize that it gives the children an early start to role modeling. So, the early years is where you decide what you want to be when you grow up. You want to be a policeman, you want to be a doctor, you want to be a firefighter. So amongst the community as well, you see these role models in the community that are involved. So most of our markets are within central business district, and around those central business districts, you see community people all the time. You see police officers, you see nurses, you see doctors, you see different public servants as well. So these people interacting with our children on a daily basis also gives them that idea of positive role modeling. And one of the things that we've done is to introduce career days to the students. So as they start in the early developmental stages, they also know, okay, these are opportunities that we can look at. And of course, field tripping at that age as well. So they go to different locations within the city to just begin to get hands-on experience and really see who's around and begin to spark their interest when it comes to what they want to be when they grow up. Some of the other things that we've noticed with our young people that we work with are the ideas of, just building self-esteem. So one of the things we realized with some of the young people, they come into the daycare without knowing their numbers, knowing their shapes. Again, most of the students in the schools are around the age of 3. So just learning their colors, learning their songs, learning their shapes. We've noticed within a 6-month period, there was a hike, just children becoming more confident, building their self-esteem when it comes to speaking, public speaking, just even singing songs daily and being able to connect with other children. We've noticed that some of them are building confidence and self-esteem in that. So there are lots of opportunities when it comes to, the holistic approach and inclusion when it comes to public sector supporting early education instead of just leaving it to private sectors or, individuals. And of course, the idea of when government comes in and plays a role, just making it affordable, especially for those who are less vulnerable, who may not have the opportunity to give their kids early education.
Thank you so much, Adara. That was very interesting to hear about this holistic approach, and I love how you have taken the opportunity to start working on the needs of women with the caretaking responsibilities to also address several issues that are very important with younger children that can also have impacts later in life. So that was very fascinating to hear about. So thank you all of you for these incredible examples of gender equity efforts underway in our cities. We have a few minutes left for a few questions, so I'm going to start with our last two speakers, Florencia and Ajara. You both spoke about exciting initiatives that would channel resources to address a critical responsibility that is disproportionately handled by women, which is caregiving. Can you talk a little bit more about the broader social benefits that can be shared by a society when caregiving is understood as a public good rather than an individual or internal family responsibility? Florencia, maybe you can go first, please.
Yes, just like I mentioned, incorporating this as part of our priorities in the public agenda actually leads to greater responsibility from different actors. It involves also the government and the state intervening, as the example of having a personal problem, a personal burden be taken on by a broader sphere. The idea is to have freedom to work, the freedom to be independent, financially independent. And whatever we can do when it comes to improving this responsibility of taking care of others will generate benefits that will allow women to have more financial independence. And if women can actually be more independent, the city itself will also benefit. So when we talk about that freedom, development, progress, at the end of the day, what we're talking about, well-being within the society that benefits all. So we have to be involved in this, and this will bring on greater quality, more freedom for a more inclusive society.
Thank you, Florencia. Ajara, how about you?
Yeah, so similar to what Florencia said, I think, when it comes to social participation and social inclusion, there's this old African proverb that talks about it takes a village to raise a child. And as much as that's an ancient proverb, it's still something that pretty much is still the foundations of what African countries stand up on. And when it comes to caregiving, this is the stage where you see women are the number one people that are standing at the forefront of these issues. And when it comes to economic empowerment, you also see that it also bring them at the back end of economic empowerment. So how do we provide a space where women can also provide that support when it comes to the caregiving, as well as develop their economic sustainability, which is one of the reasons why our early child care centers were created. You don't have to leave your business to go home and take care of your child. We've been able to provide you that space where your child can actually gain their early education, and you can still bring home your money at the end of the day. So I think it's approach that governments really need to see, how can we make sure that we create holistic approaches instead of saying you put an egg before the cart or whatever the case may be. So we don't want to we want women to come and take spaces and also giving them opportunities. So really looking at the lens from a female or a feminist lens. I think, when I was speaking earlier about the mayor and coming out, we've had lots of mayors throughout the city of Freetown, but no one actually saw the fact that these children were just sitting, playing at their mother's working place. So when a female lens was given that view, she was actually, as a mother, as a woman, she was actually able to see the fact that these are children who should be in school at that age. Why are they not in school? How can we resolve this issue? So I think, when it comes to governance issues as well, this is where when you have women at the forefront of governance issues, they tend to see things differently than our male counterparts. And it's also very important for us to have, community leaders within the space. One of the things that we really do are very hands-on when it comes to the woman within the community being at the table of these discussions. So when we make decisions, we bring them to the table, we ask them what their views are, what their thoughts are, so that we're not only making decisions from the hierarchy position, but also really understanding what the needs are of the people that we're serving. So I think when you think about caregiving, we need a holistic approach and an inclusive approach, but also we need to look at some of these things from a feminist lens, because sometimes our male counterparts do miss it, whether it's part of who we are as women. We tend to see things differently, and we spend most of the time and at the home. That's where, most of our jobs are as well.
Thank you, Ajara. And I think you brought up 2 points now at the end that speak to all of the policies that we have been discussing today, which is this need for women to be consulted and in position of decision-making positions, and also the relevance of having this consultation process, right, with communities. So thank you so much. I'm going to turn now to Heidi. Heidi, you mentioned in the beginning of your speech the challenge of dealing with this issue that has always been a taboo. So I would like to hear more about how you crafted this new menopause policy. Can you tell us how you navigated the social bias that society have, like ageism and sexism, to create this policy?
Yeah, sure. I think at an organizational level, there are 2 things that have helped us. It already places strong emphasis on equality issues. So, for example, we have a number of staff networks with an equality focus, for example, on women's issues, on disability, on race equity, and others. And the second thing is that we have strong leadership support for the introduction of a menopause policy. The mayor has committed to this, and the senior management. So we have a good starting point. In terms of the policy development work itself, we're doing various things to try and ensure that there's no room for social bias. We're consulting widely with various groups, as I've mentioned, within the organisation, and also with all staff directly. And by doing this, we get useful feedback on the content and the wording of the policy at an early stage and can incorporate this at that point. We've made it clear in the policy document why the policy is relevant to the workplace and what the benefits are to the organisation in taking action. Also that it can be a very significant issue for some staff. It isn't just about the stereotypical issues such as hot flushes, which everybody has heard about. We explain in a bit of detail the range of possible symptoms and what can be done to help. We explain that it can affect younger people and that it can have an impact on work colleagues, friends, family members, etc. And by doing all of this, we're hoping to tell staff some things they didn't know and to ensure that staff take this seriously. When the policy has been completed, we will be consulting very widely, publicising it throughout the organisation. Publicising very widely. We'll plan various communications to staff, summarising the policy, its contents, its aims, etc. And we'll be asking senior managers to cascade it to their teams. And we'll keep up that level of communication so that we continue to raise awareness and keep it in the public eye. So to summarise then, our aim is to normalise this as an issue for discussion, and so in future it won't be a taboo subject. And of course we want to convey the message that this is a serious issue and that discrimination won't be tolerated. Thank you.
Thank you so much, Heidi. And it's very interesting to see how many different strategies you have used to be able to overcome this biases. And I really like the consultations, the issue that you mentioned about having the relevance, the importance of having the strong leadership on this, and this idea of sharing, explaining what it is and the benefits of addressing, right, and in your dissemination and raising awareness strategy. So very, very interesting. Thank you so much. I'm now going to turn back to Mexico City and Barcelona. So Sonia and Ingrid, it seems that you have both applied a gender lens to general functions of governments, things like budgeting and maintaining safe public spaces. What are the challenges to incorporating this type of lens in your work? Maybe we can start with Sonia.
Yes, of course. Before answering, thank you to all of you. Congratulations. It's very exciting to hear all these best practices. In our sense, that gender lens is essential, but also in our fiscal policies, part of that systemic change that will implement that integral strategy at a local and governmental aspect. But it should be implemented with different tools as public hiring and services, the creation of a system for childcare or dependent care, as we have heard also, but also that economic alliance that puts people at the center of everything. If we are able to combine these different solutions, we will be able to actually make progress towards gender equity, to redistribute this responsibility and stop the feminization of poverty. And just to answer to your question, all these challenges have to do with these different dimensions. First of all, to increment participation, creating spaces in which the public administration can interact with civil society, that feminist movement, academia, experts that come from different areas. It's important to incorporate a women's voice in these different phases in this political process, to understand their experiences, to become a platform for their voices, and to create that transparency for all of them. As we've heard also, it's important to improve these channels of information in which we carry out this analysis. And we've identified room for improvement in these communication channels. We need better diagnostics to adjust our policies. And in this sense, we also have to work on that disaggregation of data on gender, based on gender. And it's important to do so, but it is also important to identify other variables such as location, age, sexual orientation, disabilities. What kind of information is important to tweak or understand even better those different intersectionalities that affect our policies. But also we need a great collaboration between different departments and different government institutions to ensure that the entire organization, all of our organizations, can contribute to policies that will deepen these changes that are needed for that strong gender equality that we all are fighting for. Thank you.
Thank you so much, Sonia. Ingrid? Yes, we can hear you now.
And following what Sonia mentioned, which is essential, it has to do with the coordination among institutions. And this may seem obvious for us because we are civil servants that share, that public sphere, that have those same strategies, but coordination is actually a challenge by itself to coordinate the different visions. For example, the operational phase that has that priority with logistics, architecture, the intervention in a space, but also combined from the Women's Secretariat, the fact that we have to have that gender perspective in the architecture or the operation phases. But as Sonia mentioned, also to recover those data and that data be identified within different variables, that disaggregation by gender, but also this differentiated impacts, how these affect women, how a specific policy might affect women. And this leads to another challenge. As Sonia mentioned, she talked about these wide array of impacts or challenges that we come across when we implement these policies, and it has to do with training. How to come about when we are designing this new infrastructure, for example, lighting the streets. Street lighting also has to keep in mind women's and girls' safety. And in this sense, training is essential in areas such as public works, citizen safety. Only 20% of the people that are carrying out the work within the portfolio of citizen safety are actually women. So how can we go about to make progress in the sense that we need to incorporate women's perspective or gender perspective in these different spaces that might have been traditionally sexist or mainly populated by men? And of course, so those two challenges, that coordination and also that gender perspective training.
Thank you, Ingrid, so much. And thank you all for these inspiring responses to the question that we posed at the top of this program today. What can cities do to advance gender equity? Hopefully you're walking away from this discussion with a lot of thinking to do. And this Thursday marks the annual International Day for the Elimination of Violence Against Women. I encourage you all to recognize this day and, if possible, engage with the 16 days of activism against gender-based violence, a campaign that begins on the 25th and will continue through December 10th. Thank you all as well to Melissa, Ruth, and Nina for the earlier chat. And I would remind you to visit citieschange.org to download the Gender Equality Toolkit in either English or Spanish. You can also follow Change on Twitter at the handle @CitiesChange. This program will be available as a video on the Change website in a few days, so please feel free to share this with your colleagues and friends who may be interested in learning some more. Thank you all again for joining us.